Hi, hello. Thank you for watching this on the replay. Good to see you. Welcome. Glad that you're here. So today I'm going to be going over with you how to answer NCLEX questions and just giving you the best type of framework and formatting when it comes to answering these type of questions. If you want to learn more as far as like what we do, how we can help you, make sure you visit our website www.choosenursing.net or comment the word below guide and we can send you a free NCLEX generation guide to help you to study for your test. If you're watching this right now on TikTok, then make sure you go and press the link in our bio for some of the resources that we have through the link in our bio. So let's quickly go over how to answer NCLEX type of questions, next generation questions. This is an area that a lot of people struggle with and just don't feel confident in, and so I'm going to help you to better understand this area. So first and foremost, when it comes to the questions, you have to have a solid foundation in the content, right? You have to have a solid foundation in the knowledge of the content so that way it really actually makes sense to you. And it's not just only where you're trying to do, a bunch of questions, but you truly understand the foundation of the content of the material. So the first thing when it comes to answering questions is that you need to identify what the question is actually asking you, right? And so one thing I've noticed for a lot of people, thank you for the likes, is that the reason why people are not answering the question correctly is because they're not identifying what the question is actually asking them, right? So they're considering something that's not in the question. They're thinking about something that's not based on what the question is actually saying. So you have to. Many times the question is trying to see a few things. It wants to see if you are a safe nurse, right? So it wants to see if you're a safe nurse. It wants to see if you understand safety of the patient first. If you also understand the medications and why we're giving the medications, along with the side effects, adverse effects. The one thing that I really will stress highly is the why. Do you know the why? The more that you understand the why, the better you're going to do when it comes to all the material, all the content. So, for example, if you see a question and you read into the question, you have to ask yourself, okay, what is this question asking me? What is it trying to see? And for example, okay, let's say you have a question, the question has to do, it says the patient's on Coumadin, right, which is a blood thinner. So then as soon as you see either the diagnosis or it names the medication, you should be immediately thinking, what are the biggest concerns with patient on Coumadin? What are the biggest symptoms or challenges with patients that have X, Y, and Z diagnosis? Those are the thoughts that should be going through your mind, so that way when you look at the question, you can be able to recognize what is possibly asked of you. Right, so if I have a question that says, okay, the patient's on Coumadin, and then it says, okay, the patient says I'm going to eat this in my diet more as a result of Coumadin, and one of the things is like broccoli or green leafy vegetables. Well, you know that Coumadin is a blood thinner, right? Coumadin is a blood thinner, so if they're eating green leafy vegetables more, then that's going to be a problem because the patient's going to be, it's going to be an antidote to that drug, and it's going to cause the drug not to work as well. So this is how you have to be thinking. And that's a very simple situation, but that's an example though, just to help you to better understand it. So that's the first thing. Thank you so much. Is what is the question asking you? And usually times it's asking you based on whatever the side effects, adverse effects, potential problems, potential complications, safety issues, and normal interventions based on whatever the diagnosis is or the medication or the procedure that's being done. Number two, the second thing you need to pay attention to are the key words, okay? I go over this multiple times with the people, is keywords, keywords, keywords. I'm going to tell you some keywords right now that you should pay attention to, and I want to encourage you to write this down if you're really serious about doing well when it comes to your test. So the first one, the keyword obviously is the diagnosis, right? Whatever they say the diagnosis is, that's always a keyword. Now, it doesn't mean that the problem in the question is that diagnosis currently. So for example, if it says, oh, the patient has had a heart attack in the past 3 months or whatever, and now they're complaining of shortness of breath and edema in their feet, then you should identify at that point that now they may have CHF or they may have heart failure. See what I mean? So this is what I'm talking about, is that it's the diagnosis is a key word, but then you have to pay attention to whatever the circumstances are that may insinuate that there's something else new now going on with the patient. So obviously the diagnosis, the procedures that they're undertaking, and then any medications, those are clearly keywords that you need to pay attention to. And then of course, age, right? So if the question literally says the age of the patient in the question, that's very significant. It's pretty much giving you a clue of how it wants you to answer the question. So the age is going to be factor in what is the normal aging process, right? So if it's patients that are between 0 years old, meaning they're newborns, all the way to 18 years old, then you should be immediately thinking of what? Erickson stages of development, right? You should be thinking about those stages of development once it mentions the age, because then that gives you a clue as far as what is the most likely concern or most likely problem that's buried in the answers or buried in the question. Then if it also tells you the age, depending on the age as well, will also signify the type of problems they're more likely to have. So for example, if it says the patient is 70 years old, that's elderly population. So then of course that means that patient's going to be, they're going to be more prone to what? Not being able to metabolize medications as fast, so they need a smaller quantity or lower dose than other patients. Going to be more risk for pressure ulcers, more risk for falls, that type of stuff, right? So the age is a clue. Another one as well that's also a key word is the patient's ethnicity. The ethnicity is a key word when it comes to questions. So if you don't study if you don't study the perspective that the NCLEX has as far as ethnicity, based on the medical problems or medical conditions that different ethnicities are known for, or that we're exposed to in nursing school, then you're not going to understand the question well. You're not going to realize that it's giving you a clue on the answer. So, for example, if it mentions that the patient is Native American, so if it says that they're Native American and they come in complaining of they come in and they have a fruity breath odor, then that's going to usually insinuate diabetes, right? So some of the things that I remember learning in nursing school is that Native Americans may have a history of diabetes, type 1 diabetes. African Americans more prone to conditions like hypertension, heart failure, coronary artery disease, things like that. So you do need to study ethnicity. Another thing too that we've learned as well in nursing school, this is all in nursing school, so don't take it as being bias or racism or anything like that. It's what we're honestly taught in nursing school. I remember having my own viewpoints, but it's the reality of how we were exposed to healthcare. So another thing that we learn in nursing school too is that people in the Asian population tend to have a higher pain threshold and are more adverse towards taking pain medicines, right? So that's another thing too as well. So anytime it tells you the patient's ethnicity, the ethnicity is usually a clue or an insight to to some type of common history related to that ethnic group. So age, ethnicity, diagnosis, procedure, medications, these are all keywords when it comes to the NCLEX exam, all right, or when it comes to answering questions. Then the last thing you want to do now, once you now narrow down based on the keywords, Now you want to begin to look at the answer choices and narrow down the answer choices. So one of the things for a lot of people is that they'll eliminate the answer choices, but then they won't do it well, you know. And so they're really narrowing it down to the wrong answer choices, and so that's the reason why they're not getting the answer correctly still. So when you're limiting it down to the answer choices, think about, and we'll first talk about this as opposed to like static questions, but first think about, okay, which of these choices would be the least safe for the patient? Usually go ahead and throw that one out there, all right? So a lot of times if the question says the patient has, if the question says, like, for example, okay, continue to monitor, you know, anything that insinuates don't do anything is usually the wrong answer, you know, because it usually shows that you're not proactive as a nurse and you're not, you know, looking out for your patient's best interest, that type of stuff, right? So these are the examples of what I'm referring to. When you're eliminating the choices as well, a big thing too is that the entire sentence has to be correct in order for the answer to be correct. All right? Let me say that one more time. The entire sentence has to be correct in order for the answer to be correct. Why do I say this? Because, so let's say, for example, the question says, okay, you have a patient and the patient is on Coumadin, right? And so it says, okay, which of the following choices would indicate the patient understands the medication that they're on? Usually it's like would require further teaching, but for the sake of this, I'm just going to say this. And so the answer choice says, welcome. The answer choice says, oh, I will make sure to take this medication every single day, and I will increase my intake of vegetables, right? So the first half of the question is correct. They should be taking medication every single day, but they should not increase their intake of vegetables. If anything, they should decrease it, right? Decrease it or just keep the same amount that they're normally taking. So, and one thing that a lot of my students often end up missing, and what causes them not to pass their exam, is that they pick the answer choice, but it doesn't have the whole statement isn't correct. Most of it is correct, but one of the key words is wrong, right? So if the key word, for example, it says increased, but it's supposed to be decreased, it's wrong. If it says that the patient's supposed to take it in the morning, but it should be taken at night, but it's the correct medication, it's wrong, right? So this is what I'm referring to, is that the whole statement has to be correct. And then sometimes what you have to do too is that sometimes you honestly have to just read the question again. Read it again. Review it one more time to make sure that you understand what it's asking you. Because a lot of times what happens for a lot of people is that they will read the question, right? They'll read the question, and then when they read the question, they'll go through the choices and they'll forget that the question said, oh, pick the one that wants further teaching, not the one that shows that they understand it, right? So meaning that they'll pick the negative versus the positive of what it's asking. So usually what I recommend is that you read the question, read the choices, and then read the question again, right? And that shouldn't take you more than a couple of minutes to do, right? You should not be running out of time when you take the NCLEX. If you're running out of time, then that honestly indicates that you're not comprehending the material fast enough, and you need to spend a little bit more time with content review before you really understand the questions. If you find this helpful, make sure you go hit the like button on Facebook. Hit the like button so that way I know you find it helpful. And then go ahead and comment below and let me know that you're finding it helpful, all right? So here's the thing. The last thing is that if you really want me to show you how to better prepare for your exam, this upcoming Friday, right? This upcoming Friday, I'm having a free review where I'm going to be going over case study questions. All right, case study NCLEX questions is what I'm going to be going over. So it's going to be a free event. It's live. There's no recording, so you need to be present so that way you can get access to it. So if you want to register for free, if you watch this on Facebook, even if you watch this on the replay, comment the word live if you want to get the link, and we'll message you the link for those on Facebook. If you're watching this here on TikTok, go ahead and go to the link in the bio, all right? Go to the link in the bio to register for it free right now. Hit the follow button. If you're not already following me, go ahead and follow me right now. Follow or like the page or subscribe, whichever one, so that way you don't miss out on these notifications. And then go ahead and click right now in the bio to register for this upcoming event. It's going to be a PowerPoint. I'm going to be showing some slides, and I'm going to be showing you step by step how to answer case study next generation questions and breaking it down for you live so that way you really understand it and you can think more critically. Once you're able to think more critically, able to comprehend the material, answer the questions, what will happen? You're going to begin to boost your confidence. You're going to become more confident with the material, and then what will happen as a result is that you'll be able to finally be able to get better scores on your test, on your practice scores, and then now you'll be able to actually pass your NCLEX exam. And if you pass, and when you pass your NCLEX exam, what does that mean? Now you have a license. Now you can begin to move and navigate and get yourself a new house, like one of my students have done. Literally be able to now buy a new house, able to get a car, able to move their kids out of bad housing, bad neighborhoods, because now they landed their dream job that they were looking for. And they didn't have to work so many hours. I've had students literally that telling me they're literally working 80-hour weeks, literally. They work Monday through Friday. I was so sad when I heard this. Monday through Friday, 8 hours a day, and then at night, they'll literally work 3 days a week at night for 12-hour shifts during those same days just to make ends meet because they can't pass the NCLEX exam yet. That's the reality of many people, and it doesn't have to be your reality. Go ahead and click the link in the bio right now to register for free, or comment the word live on Facebook so that way we can send you the link. All right, thank you for tuning in. Hit the follow button if you're already following, and I'll see you guys the next time.